A lot of the clients that we see here come in with various musculoskeletal complaints, soft tissue complaints, not necessarily a broken bone or a fracture, but things that we claim or we entitle soft tissue musculoskeletal. And when we ask about these complaints a little deeper, we hear about neck pain, vague complaints of shoulder pain, some low back pain. And then when we study a little further and get an understanding of what these folks do, a lot of times it's day in and day out cumulative trauma, if you will, on what people do at the workplace. Prolonged sitting, prolonged standing on their feet in a warehouse on concrete cement floors. A lot of what we see and a lot of what I see in the clinic is cumulative trauma or repetitive trauma at the workplace. A lot of those folks, they don't have to be doing a lot of lifting or a lot of standing, but sedentary sitting. Low backs get tight and stiff. We might have folks who complain of elbow and wrist pain because of data entry, keying repetitively through the day. Tightness in the shoulders because of seated posture, and sometimes not always the best posture. People have a tendency to want to slouch forward, move forward, not always keep erect posture, and that a lot of times is a postural stress. So when we further ask about workstation setup, that helps us to really address a physical therapy program that might help remedy that. And what we do in the office and what we do in physical therapy is just not the answer. A lot of times we really need to educate that person on what they're doing during the course of their day to help remedy their soft tissue complaints. One big factor is the type of chair they're in. Is that chair suitable for them? Do they have a back support? Are their feet touching the ground when they're seated? Do they have enough lumbar cushioning or low back support? How are the wrist rests? Are their forearms in a comfortable rested position? Is the computer too far away from them? Lastly, headsets are very valuable. Prior to headsets, people would often be seen cocking their head into the receiver of the phone, thus giving them a lot of torsion on the neck, causing neck stiffness, headache, that type of soft tissue complaint. And then, of course, with the headpieces or an earpiece, a lot of times that's remedied and people are a little more free to hold their neck and shoulders in a better position. The best is if you can get up every 30 to 60 minutes, move around, change your position. In some instances, they might have been assigned some wrist, hand, elbow stretches that they could do right at their computer, right at their monitor every hour. And that's the optimum. So if you can take frequent stretch breaks through the time of your office task, move around a bit, reshift your position, do a few stretch breaks. It allows increased blood flow. It allows circulation to happen a little more effectively, and thus you feel a little less stress, a little less pain, and a little more flexible.